Good morning, good afternoon, good evening, depending where you are. This is Firoz Manji from Daraja Press. As you can see, our website is up there, darajapress.com. And I'm very pleased to welcome you to the show today. Today, we're going to be speaking to Nathan Banda from the Zimbabwe Congress of Trade Unions. We get very little coverage in the mainstream media about what is actually happening on the ground in Zimbabwe. What is the situation that's being faced, and what is the labor movement's response? And given the shutdowns that are happening, how do workers organize? How does the labor movement organize? And how do we reach out? How does the movement reach out to the informal sectors? I'm really pleased today to have Nathan Banda from the Zimbabwe Congress of Trade Unions. Welcome, Nathan. Thank you so much for joining us.
Thank you. Thank you very much. Thank you very much.
It's a great pleasure to have you on board.
Thank you.
Maybe a quick overview about yourself. You're the Safety and Health Officer at the Zimbabwe Congress of Trade Unions, aren't you?
Correct, yes, I am.
So what does that involve? Hello?
Hello, yes, I can hear you.
So
yes.
Tell us about your work. What does a Health and Safety Officer do?
Right. Thank you, viewers. Like said, my name is Nathan Banda and employed by the Zimbabwe Congress of Trade Unions as a safety officer responsible for carrying out workplace inspections and at the same time assisting employees claim their compensations after injury. You know, sometimes it's very difficult to follow up on your compensation claims. So that's my responsibility. And at the same time, helping affiliates develop policies in occupational safety and health, as well as following up and advising them on issues to do with pensions, social security, and the like. So basically, this is what we are doing.
Right. So in the time of COVID, how has that changed your work? What are the challenges you face?
Yes, that's a very good question. You know, COVID-19 got us unaware. You know, it really caught us unaware. We had not really anticipated this would come about, but right now it has given us a new way of organizing ourselves and responding to it. And already when it was declared a national disaster, we really, you know, jumped around to see how best could we come up with preventive strategies. And this is what really I will also, you know, like talk about as we proceed. But otherwise, the question of COVID-19 is really, you know, giving us a challenge. As it is, we are really on lockdown for the next 21 days. And what does it mean to the membership itself? And what does it mean in terms of the department reaching out to those infected? How is the setup like? And I'll also, you know, give you a bit of that kind of challenge that we are facing.
Right. So, I mean, perhaps you can help us understand. I mean, how many cases is COVID
Yes.
actually
Yes.
affecting people in Zimbabwe?
Yes, it is. It is just like it has done at global level. Already, Zimbabwe has confirmed 11 cases, with 8 of those, you know, patients having recovered, and 3 confirmed deaths. That's a big number. You know, when I look at it, it's something not to really say, look, after all, the figure is odd, and we are better off than what we hear happening in other countries. This is an indicator that if we don't act quickly, these figures may really reach alarming stages.
And I mean, I assume that there's very little testing going on, and so you don't actually know how many people are infected. Am I right?
You are right. The challenges with the testing kits. In as much as efforts are being made to really see how best we can go on about the question of testing kits, ventilators, and so forth, it remains a challenge. And
Right.
with social media also projecting and saying a lot of things about some of these test kits and so forth, that look, please resist, don't allow, don't, that's again another challenge we are facing. And now going to people and saying, okay, let's go for testing, it's good for you and me, becomes a tall order. But otherwise, the bottom line is that we are still lagging behind in terms of the testing of
So,
everyone.
so what has been the government's policies in regard to COVID? You mentioned lockdown. Can you elaborate
Yes,
what their policies are?
yes. What it is that now everyone is supposed to stay home and make sure that we don't really shake hands. Um, uh, 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 we have to have our masks on, every time, and keep at a distance of 2 meters, social distancing in this respect, um, and that most of the shops should be on shutdown, save for those that are essential services like the pharmaceuticals, hospitals. Those are areas where given letters, you would really, pass through and go to work. But up to a certain time, say from morning 8 o'clock to about 3 p.m. As I'm speaking to you right now, business is shut down till tomorrow because they are saying we need to contain these schools have been shut down, and so on, just like what is happening at global level in terms of really the
Right.
shutdown. Yeah, and all of us think South Africa is even extended by another 2 weeks,
Yeah.
which means this is a serious issue.
So, so the government's coming out with policies which many African governments have also come out with: social distances, washing hands, using
Mhm.
soap.
Yes,
Okay.
yes.
Now,
And it is also,
what does it actually mean for the majority, for example, of Harare's people who live in the townships?
right. I have a
Is
challenge there.
social distancing is really feasible there?
Yeah, I have a challenge, in that respect, because look at it this way. Basic commodities are quite scarce. Like now, the staple food, like mili is scarce. And wherever there is delivery of maize, for example, you get people going there and crowding, making it a bit difficult. It's really compromising, giving us a challenge in terms of social distancing. But nevertheless, we now have the majority of people maintaining that, but very difficult, of course, very difficult.
So, in terms of how do people have enough access to water? Do they have access to soap to wash their hands whenever they're touching anything else?
Right. Soap is not a big challenge, but it is water and sanitation, which I would like to really stress here. Take, for instance, Harare. Of the suburbs are without water, and the government said it at one stage that they are working 24/7 to ensure that every citizen accesses clean water. And this is the current, scenario. So what it means is that honestly, the issue of water remains a challenge. And now, when you really are talking about washing hands, and so forth, when there is no water, it becomes a challenge. And buying water is one of the most commodities, or things to do. It's very expensive. So that's $1 million challenge, water and sanitation. Up to that time, that is corrected or resolved, then we'll be talking about, compliance at maybe at 100% levels.
So in effect, the core of the government's policies
Mm.
are just not practical for the majority of Zimbabweans. Is that what you're saying?
So, sorry, the call come again. Was
The core policies that the
mm.
government is putting forward, social distancing, washing hands, uh, in practice is not viable for most Zimbabweans. Is that the case?
Right. Whilst of course it may appear viable here and there, but it remains because of some of the factors I've just mentioned. You know, like right now, of course, people are already home, but the social security aspect, most of them have just gone home, and employers have simply said, "Look, we won't be able to pay you whilst you are home," and already there is hunger. And what the government has done, especially those from the informal economy or SMEs, there's been an announcement, a pronouncement that, look, you register with us so that we reach out to you and give you the cash, kind of through cash transfers. And now when you're looking at 95% of unemployment figures, and we're looking at 5%, which is formal. So 95% is quite a huge figure, for example. And we are not sure who exactly is going to benefit, because then the policy is not clear whether the workers are going to benefit or how is it going to happen. Because honestly, you need to have a sound database that will leave no one behind, the way I look at it.
Right.
The
But, I
intention is
mean,
very good.
there was a report recently, actually on the government Ministry of Health and Childcare's website, that
Yes.
the European Union has committed an additional 20.6 million euros to the Ministry of Health and Childcare. How will these funds be used? Are they being used to compensate workers who have been working in industries that have been shut down?
No. I'm in that respect. It now, like I said, it's now left upon the task force, those so appointed to look into how best those funds are going to be utilized on, because at labor level or ZCTU level we are members at the TNF. We participate, and that's where we discuss most of these challenges. And I think this issue of the EU with the resources coming in, Labour is definitely going to table that and find a way of how those resources are going to reach out to the workers who may have lost their jobs. Because right now, with this 21-day lockdown, a lot of workers' contracts of employment have been terminated, and casual workers have not been, spared either. So you can see this is one of the greatest difficulties labor, movements are facing worldwide. Because employers are finding it easier to now retrench and lay off staff, and because they've tried, they are now seeing that working from home as a concept is the way to go. And well, why not lay off 10 or 20 people and I continue with people working from home and maybe pay them on a commission or on an agreed kind of figure. This is one of the difficult moments we are all facing as workers. Because look, I was just receiving texts from different unions citing these challenges that look, they've been told to really debit their vacation days, leave vacation days, have them debited. And by the time you go back, you no longer have any days for vacation. You no longer have any, special leave days. You no longer have any sick leave days, for example, because all have been wiped out. But in countries where there is a very strong, a very comprehensive social protection system, governments have taken over to say, okay, we'll pay workers maybe like, is it UK? We said 80%. And so this is what we expected, of course, that Zimbabwe would do the same and say, okay, we'll carry the burden and pay the workers to alleviate the challenges employers may be facing. So these are some of the challenges we are experiencing.
One of the things that we've seen in a number of countries in
Yes,
Africa, in Kenya,
yes,
in
mm,
Uganda, in Ghana, and in South Africa, you have
mm,
seen the militarization of the streets. That is, the police and armed, of sometimes the army, are put
mm,
on the streets to round
mm.
people off. In other words, coercion, repression is part of government policy, even if it isn't explicitly said. Is that happening in Zimbabwe?
I would say I'm in Bulawayo for now, right? What we have observed is that those people who have been found loitering in town and in different places, some of them have been like, arrested for not observing the order, the declaration that all should stay at home and no movements, So if you are found, loitering and you are not sure where you're going, these are kind of challenges you really face up with. So now there was also a declaration. I remember the president saying the army will come in and then complement the efforts of the police in ensuring that there is compliance, sort of 100% compliance. And this is what is happening. There are roadblocks here and there, and wherever you're going, you have to produce a letter asking you where you go. I mean, to allow you passage, and these are kind of issues that are happening, in Bulawayo, and I'm sure this is what is also happening in other, provinces.
So once again, as we had in our history, the passbook is being brought back. No, I'm
Yeah,
only kidding. um,
right.
Nathan, you mentioned that health workers and
Mm,
nurses and others are considered part of the essential workforce.
yes,
Um,
yes.
uh, I heard that the doctors have sued the Zimbabwe government over a lack of protective equipment,
Mm,
and their court application says that many lives will be lost
mm,
without urgent action to provide
mm,
face masks and other
mm.
needed equipment.
Yeah.
What can you tell us more about that? Can you tell us more about the doctor's actions and
I, I
how the
I
government
think
is responding?
I think this issue of doctors, even before the COVID-19, has been an issue where doctors really went on strike, citing incapacity and so forth, to say we're incapacitated and so forth. And now with the COVID-19, um, the issue of PPE still remains a challenge, though through the media and other partners or donors are really coming in with a whole range of donations, in the likes of the surgical face masks and so forth. But the PPE does not end there, Even if you have a number of masks and so on, there are also other tools that should be, given to health workers to prevent, the spread and so on. So this is really the challenge that they are facing, and in terms of the court processes, it remains, to be seen how it's going to proceed and how it's going to be concluded. But otherwise, this is, some of the challenges. And these challenges of the PPE are not only with health workers, they are also, with the generality of workers in the private sector, for example. In the informal, sectors or economies, you still have these challenges. We were of the view that there should be possibly a rollout program that would make sure that people get those for free, for example, and scaled up campaigns and programs on issuance of these, PPE gadgets and so on. So these are some of the issues. Yeah, that's how I think how far I can comment as far as this issue of the court processes.
Right. Are these unionized workers? Are the doctors and the nurses, are they unionized? Are they part of the Congress?
No. They are not part of the Congress, unfortunately. But they fall within the civil service, the apex council bodies, and so of course most of them are civil servants. But I heard, in the corridors at one stage before the declaration of 21, day sitting, that there were some people were contemplating setting up or putting in place a union that would be looking at the welfare of health workers, which I thought was quite a good idea. And that union wants to affiliate to the Zimbabwe Congress of Trade Unions, and I would personally support that, because then we'll be talking about the health workers in the mainstream of the labor movement itself.
Right. And how are informal workers, informal sector workers affected? I mean, you visit Bulawayo,
Yeah.
you visit Harare, you visit any of these. A lot of the food, a lot of the whole infrastructure seems to run on the basis of people being able to be on the streets and supply foods, etc. What's happening in Zimbabwe now in relation to that?
The interesting point is that the president took a tour within Harare to make an assessment of compliance, and it was after that when there was a relaxation to say, okay, those who are trading, especially selling tomatoes, vegetables, and so forth, could go back and start selling their products. And there was delight amongst those in the informal economy from within various locations. So, but my point really around informal economy or vending is that with social distancing now, the way to go. Harare, if you have been to Harare, there's always been a lot of people selling their products, and that I see is going to change, right? I see that's going to change now. And what does that mean? Is that most of the people their livelihood would be compromised, and they will have nothing to feed on. This is what I really see will happen. So there will be more kind of poverty amongst different families within different groupings and so on. So these are concerns that I think as informal economy or as the labor movement, we need to sit down and review and revisit and strategize on how best we could really assist the informal economy players. How would we do it under the COVID-19 pandemic? Because policies are really changing this time around. Yeah, they are really changing.
You mentioned earlier that one part of the government policy is about working from home, but what does it mean for people who are in townships? I mean, how do they work from home when most of them probably don't have internet connection?
Yes. Working from home, when I look at it, is going to also present itself with other challenges. Stress would be one element that we may really overlook, but is likely going to happen. Why? Because one, connectivity is a challenge, and putting up a Wi-Fi, system is expensive. If I were to really, you're looking at payment. If you want to really have a good, you'd pay as close up to $1,000. So that's very difficult, because $1,000 is not much. Not many people have that much to really pay towards communication. So that in itself will really create another challenge. People will start to experience high levels, stress, high stress levels, because of unfinished or assignments, for example. Where some assignments would be through emailing and talking to you like I'm doing, but if I don't have connectivity, that's one thing that will really send me into sleepless nights. So that's one problem, which will be an occupational illness when I look at it, because then I'm at work, but I have this challenge.
I mean, I think the issue of stress not just caused by lack of access to the internet, but being confined at home, large number of people in the home the whole time.
Yeah.
One of the things that are increasingly being reported in a number of countries is the escalation of both violence against women and child abuse. Is
True.
this something that you are seeing, or
That's true.
is that something that's happening in Zimbabwe?
Yeah, it's happening, and it has been happening even before the COVID-19 pandemic itself. The fact that you spend a weekend itself is just enough to really cause challenges or problems within your own homestead. So I agree with your point and observation that besides connectivity, there are also stress-related cases as a result of spending more time at home and confined to one place. That's stressful.
You have 4 children. How are they coping? Are they in Bulawayo?
2 are in Harare, and then I have the other 2 here in Bulawayo. I guess they are coping. I've been trying to really reach out to them, those in Harare. Well, there's compliance, they are at home, but the impact now is they are young workers. What is there for them? That's my challenge now, because of these changes. We have seen it all up to this age. We have seen it all, but in their case now, the future is a bit bleak, the way I see. Yeah,
indeed. One of the issues that I'd like you to give us an insight on, and that is, if there's lockdown, if there is very limited access to Wi-Fi, internet, and so on, what does it mean for the labor movement in organizing in the time of COVID-19?
right. We've as ZCTU, what we've done is we've set up what we call a WhatsApp group. Where we have circulated the WhatsApp to all the trade unions to reach out to us through that WhatsApp number, where we will respond swiftly in terms of challenges they may be facing. This is what we've done, but generally, this is taking us back to the drawing board in terms of how best do we really start to organize. I'm looking at a situation where after the lockdown, we'll hurriedly assemble ourselves and come up with strategies of how we can really organize, and also calculate amongst the ZCTU affiliates on new strategies of organizing. Using either social media, coming up with virtual meetings, video conferencing, and so on. These are really new strategies that we really need to look at. Otherwise, if you don't do that, it would be really over for most of the unions, the way I see it.
Yeah, I mean, those kind of strategies are probably quite useful for connecting with officials of the trade unions. But
Mm.
in terms of the membership of the workers who are members, how feasible is that?
No, the interesting part is that most of the workers in Zimbabwe, most of them, you'll find that they are really, um, technologically savvy. Really, they really, most of them are really communicating that way. This is how it's happening now.
So there's a potential for organizing
Yes, yes, because what
using
me
WhatsApp or similar social media tools.
who are really into this new approach of organizing. The old guys still have that old, school of or method of organizing. The young workers or young generation, I tell you, they are now into these gadgets and they reach out quickly, to everyone
Yeah,
within a short space of time.
yeah,
They are they are together.
yeah.
And this is the way to go. That's why I was talking about now. Look, what do we do with trade unions because this is another mode, trade unions in transition. Now we're looking at this, right? How do we really change the way we are organizing or recruiting membership? Do you have to go door to door, or you only have
Yeah.
to really go there when there is really a court case or when it's really necessary? If it's
I mean,
collection of Jews, union Jews, they are now where these transfers and so forth. As long as one has got an account number, for example, they can do that. So really, and the issues, for example, at one stage, it used to be, I will defend you upon termination of employment. You went there with that card. If you are victimized, I'll be there to do it. But now the trends have changed. It's now other issues beyond just termination of employment.
mhm.
Contract of employment are now more, there's labor market flexibility now. And casualization is the order of the day. So we need to come up with new areas of focus that would really attract the young generation into trade union movements. You
I
know,
mean, I think there will be a lot of interest across the continent
mm,
about your thinking on this, and as you develop it, I think it will be important for this how you work out your
mm,
strategy for for all of us across the continent, because I think that's the dilemma of how to organize under conditions of COVID is a major
it is,
major
it
issue.
is, it is, it is.
One sort of final question I want to pose to you. I mean,
Yeah,
um, this lockdown is going to go on for some weeks, if not months,
sure, sure.
and uh, it seems that there are, when and if we come out of it, there are two different scenarios possibly.
Yes, yes.
Uh, One is a scenario where uh, the rich, the ruling class,
Mm,
enjoys its freedom to suppress and exploit labor.
mhm,
The
mm,
other is some significant transformations of the way in which we organize our societies based
mm,
on need, not on greed. Um,
mm.
how do you see this playing out in Zimbabwe?
Yeah, I think in Zimbabwe, out of this lockdown, I see quickly going to be a TNF meeting where we'll discuss the way forward. And of course, your observations are very correct that, look, the gap between the poor and the richer is going to be even wider. You can even tell right now that those who are rich, owning businesses and so forth, are actually charging even the commodities beyond measure, to a point where the poor cannot afford to buy. And so, yes, we have no option but to struggle and get the money to buy whatever is sold for survival. So you can see, that's why I'm saying after this there will be a quick meeting. That's my intelligent guess, that there will be a meeting, a TNF meeting called. All stakeholders, social partners will gather and discuss around this aspect of the post lockdown.
Right. Well, these are big issues, and I don't think you are
Yeah,
alone in
yeah,
trying to struggle with the answers to that.
yeah, sure,
And
sure.
I hope that as you develop ideas, as you develop thinking and strategies, there will be further opportunities to discuss with you and your colleagues,
Yes.
because I do think that none of us currently have a very clear idea of what needs to be done. What's the best way of organizing in the time of
Mm,
COVID? And you
mm,
might be interested in Bolivia. The a lot of the people who live under conditions where social distancing is not possible have taken to the streets to organize, because they say
yes.
it's no more risky to do that than it is to do it to stay at home. Of course, the
Yes.
increased risk is from the
Mm,
police and the army and
mm,
so on.
mm, mm, mm,
Uh,
mm, mm,
but yes, it's
mm,
been really interesting to speak with you, Nathan. Thank you so much for
mm,
spending time with us. I really appreciate that. Are there any
mm.
particular
And
uh,
maybe
issues
before
that
you,
you would? Yes, yeah, please.
yeah, before you, I was also thinking aloud to say, look, another way of organizing would be to also go out and carry out what they call health impact assessments,
Hmm.
right? Because then these would give us indicators of the health challenges, faced by most of the workers, for example. Um, had we maybe started doing this way back, would have quickly, looked at issues around different viruses, for example, and come up with strategies of how best to really, stay healthy and safe. That's another aspect we are moving with in terms of carrying out what we call health impact assessments as opposed to environmental impact assessments.
Very interesting. If there's a message you'd like to convey to people watching this program, um, what
Message
what
I would
can
like to
yes, what would you
Yes,
like?
yeah, the message I would like to convey to everyone at regional level or globally is that please let's remember, the coronavirus is real, and we need to stop the pandemic at work. Social distancing is the right thing to do. I thank you.
Oh, thank you. That's really important. I think you've raised a really important issue as well, because the virus uh, doesn't look at national borders. This is a
Mm,
global issue,
true.
and so solidarity, uh,
Yes.
which somebody once described as what love looks like on the streets,
Oh yeah, yeah.
is something that we do need to, and organizing um, these series of video broadcasts under organizing in the time of COVID-19 is
Mm, mm,
one small way of providing linkages for people to express that
absolutely,
solidarity.
absolutely,
So
absolutely.
really, thank you very much for
I
appearing on
I
our
thank
show,
you. I thank you.
and I look forward to being in touch with you
Please don't
in the
hesitate.
future. And um, hang in there, and it's the struggle that's going to make the difference.
Thank you very
Aluta
much.
continua. Okay.
Aluta, Aluta. Thank you.
Aluta, Aluta. Okay.
Thank you. Thank you. Stay safe. Thank you.
You keep well.
Bye-bye. Thank you. Bye bye.
And greetings to your family.
I will greet them. I will greet them. Thank you.
Okay.
Same to you as well.
Thank you. Thank you.
Thank
okay.
you. Thank
Bye.
You. Bye. Bye.
That was Nathan Banda from the Zimbabwe Congress of Trade Unions. I hope you found this session interesting, and we will continue to be broadcasting. It looks like almost daily over the next week, certainly. But if there are people watching who are involved in organizing around COVID and who would like to give expression to their experiences, please get in touch with us via Facebook, or you can write to me at, I should have done this before, shouldn't I? I'll just put that up on the screen for a moment. info@darajapress.com. Thank you for joining us today, and look forward to engaging with you in the coming weeks.